It is time for a business spotlight featuring Morris Hospital and Healthcare Centers. February being Heart Month. In that vein, we're joined by Dr. Athar Saeed, a cardiologist with Morris Hospital, cardiovascular specialist. As today we're going to focus on heart attack. And, of course, people know that term, heart attack. But what exactly is going on with the heart during a heart attack?
So when people are having a heart attack, essentially what happens is typically it's either a blockage forms in the artery or a cholesterol plaque ruptures open and a clot forms within the artery, cutting off blood flow to a certain portion of the heart. Typically when we use the term heart attack, that means some sort of damage is being done. Now there's different types of heart attacks where what I would refer to as either a minor or a major heart attack. So minor heart attack, there's not much damage being done, and it's usually something you can kind of see coming. A major heart attack a lot of times can come without warning. So it's very important to try to be able to identify the features and signs and symptoms.
Is there a certain person more apt to have a heart attack than others?
There are definitely risk factors involved. Obviously smoking is a big risk factor. Genetics, you can't really, pick your parents or anything. So genetics is a big risk factor. A lot of times being overweight or what you eat, if you eat a lot of fried food, a lot of, fatty foods, high cholesterol, these sorts of things. So they definitely increase the risk. Men are definitely more likely to develop heart attacks. Now, women are more likely to die from a heart attack. And the reason is because sometimes in women, the presentation is not as obvious as it is in guys, so it tends on being missed for a longer period of time. But there are definitely risk factors that, you can work with your doctor to try to minimize.
So there are warning signs, both different for men and women?
They can be. So in men, you have a lot of times it'll be the typical, chest pressure radiating to the arm and up into the jaw and whatnot. But sometimes, what people don't understand is when people say chest pain, some people are expecting the kinds of chest pain you see people having on TV, and it's not necessarily the case. A lot of times it's just a simple pressure or a little bit of heartburn type symptom that occurs, maybe when they exert themselves or whatnot. So those are kind of the classic, any sort of pressure, tightness. Sometimes the only sign you get is dizziness. If all of a sudden patients wake up or they just all of a sudden get very dizzy. I've had patients, their only sign was that they had a passing out spell that wasn't identified. Now in women, a lot of times, like I mentioned earlier, you can have very atypical symptoms and stuff. Women are much more likely to have a heart attack without having chest pain than men are. So in women, I've seen dizziness, fatigue. I had one lady, her arms just felt weak and she was having a major heart attack. We had another lady who was just getting more short of breath, and again, she was having a major heart attack. One of her arteries were 100% closed. So most important thing I can tell patients and people in general is you have to kind of know your body. You have to know what's normal for you. That way, if you see any major deviation, it's always better to be safe than sorry.
Yeah, well, what are some of the mistakes people make when it comes to heart attack symptoms?
Well, the most important thing is we see a lot of patients who unfortunately ignore their symptoms. When you're having a heart attack, the most important thing you can do is try to get to the hospital as quickly as possible, because there are tests we can do at the hospital that can actually quite quickly determine whether or not a patient is having a major or minor heart attack or whether it's just something like heartburn or whatnot. I always tell people I would rather them come to the hospital when they didn't need to come to the hospital than stay at home when they should have come in. We see some patients, they're having chest pain for days. And again, like you said, they come in and by then too much damage has been done. I had one patient who was having chest pain for 8 days before he came in, and it turns out he was having a heart attack the whole time. He was just in Florida and didn't want to see a doctor in Florida. So unfortunately, we weren't able to save that patient. But what happens is identifying. See, I've been working in Morris for about 4 years now. And what I've noticed about the population here is they're hardworking people who don't complain. And what I tell patients is if you can't complain to your doctor, who can you complain to, I think, the thing is, if we don't know what you're feeling, then we can't help you,
Sure. Getting to the hospital as quickly as one can is pretty key, and I know the other aspect of getting to the hospital is the cath lab that is at Morris Hospital.
Yeah, that's a nice thing. So we have a cardiac catheterization laboratory, which essentially is a fancy way of saying we have an area in the hospital where we have people, we have excellent nurses, we have excellent techs that actually help us open up the arteries as soon as possible. So when somebody is having a major heart attack, the goal is to try to get the artery open within 90 minutes. We have a group of people who essentially they're always on call, and at any point within half an hour we can have the room ready and patient on the table to open up the artery. Now the way we open it up usually is we pass an IV through either an artery in the leg or an artery in the wrist, and we can actually see the blockage and use wires and balloons and stents to open the blockage up, and it helps to prevent people from having to go to bypass surgery and these sorts of things. So we're very fortunate to be a hospital our size to have something like that. We actually put in pacemakers down there as well. We have our own electrophysiologist, which is a heart rhythm specialist who does pacemakers and whatnot. We have a general cardiologist, Dr. Gordon, who's a specialist in kind of general cardiac care. Myself and Dr. Ahmed, we're interventional cardiologists. We're the ones who put in stents. We're the ones who find the blockages. And then the electrophysiologist, the heart rhythm specialist that I mentioned earlier, is Dr. Marwali. But again, they're all very skilled.
Morris Hospital had excellent times in opening up, getting a patient in that cath lab.
Yeah, we're usually, so the national benchmark is 90 minutes, and we usually average well below 90 minutes.
Sure. Outstanding. Dr. Athar Saeed, along with Dr. Saeed, he mentioned 3 other cardiologists, part of Morris Hospital's cardiovascular specialists. Along with Dr. Saeed, it's Dr. Ahmed, Dr. Gordon, and Dr. Marwali. There's office locations in Morris, Dwight, Ottawa, and Channahon at the Morris Hospital Ridge Road campus. If you want to make an appointment with one of those cardiologists, call 815-705-1000.